Thank you very much for inviting me. Crystal referred earlier to Staffordshire Hospital, and I want to say a little bit about that. 1,200 people who didn't need to die died between 2006 and 2009 at Stafford Hospital, most of them elderly people. And what came out of that, I think, illustrates the point that the speakers tonight have been trying to say. Those who go into becoming healthcare assistants, nurses and doctors, on the whole, they don't go in there to cause harm, they go in there to try and cause good. But the pressures, the workloads, the skill mix, the bullying environment, 24% of hospital consultants reported last year that they were bullied by their managers, 24% of the consultants. So what happened to the 1,200 people who died in neglect and squalor in mid-Staffordshire? They were the mums, dads, sisters, brothers, children of trade unionists. And unfortunately, like Sam, I've been a trade unionist all my life. I've been an official for 25 years. It wasn't trade unions who stood up and exposed what happened and made sure it didn't happen elsewhere. It was actually somebody called Julie Bailey, I've got a book here, who some of you will have seen on television, whose mum died and who built a brilliant group of carers and relatives in Staffordshire. She forced there to be a public inquiry, and she's someone whose book I would strongly recommend. There were staff who raised concerns. Helen Donnelly, who was a nurse, raised concerns so vociferously that every night she had to be collected by her partner at the car park because she'd been physically threatened by her bosses. She was a nurse. Dr. Kim Holt, who I work with in Patients First, was suspended for 4.5 years after she warned that if there weren't more staff put in place, there was a real risk of serious child protection problems in Haringey. And we all know what happened with baby Peter. After 4.5 years, she turned down £120,000 in a settlement. She was restored to her job with a public apology, but it shouldn't have happened. I want to just briefly say something about what happens with whistleblowers. When whistleblowers, healthcare assistants, nurses, doctors raise concerns, they don't ask whether the people on whose behalf they're raising concerns are waged or unwaged. They don't ask if they're carers or not carers. They're raising them because they're concerned about the safety of patients. And they pay a very heavy price. I cannot name, I've been doing this for some time, I cannot name a single whistleblower who was subsequently promoted. But I can give you a long list of names of whistleblowers who have been sacked or whose careers have been terminated. Liz Davis, some of you may have heard of, exposed the gang of paedophiles in children's homes at Islington some years ago. She had to give up her career as a manager in social work. There are lots of others. So it can be hard and it can be dangerous. But what this government is doing, and it's been very moving to hear it tonight, has made it more important that there are people who will stand up and speak out. More important that whistleblowers link together with other groups such as Julie Bailey's group of relatives and carers in Stafford. And incidentally, these groups have mushroomed all around the country. There's about a dozen now. Cure the NHS groups formed all around the country. So making that link is really important. And I just want to finish with a quote from the official report into Mid-Staffordshire, which said, "The common culture of caring requires replacing a culture of fear with a culture of openness, honesty and transparency, where the only fear is the failure to uphold the fundamental standards and the caring culture. And wherever we come from, as paid carers, unpaid carers, or in wage work of other time, that's something that we ought to be able to get together and stand behind and fight for." Thank you.